So my physician has ordered an indwelling retention catheter now for my patient Perry Potter, date of birth 5/5, MRN 748 581238. And I'm going to gather my supplies and go and see my patient. So I will wash my hands. Put on gloves. Gather supplies. So I have gloves, hand sanitizer, a basin with warm soapy water, a washcloth and towel, a stat load that is unopened and it is not expired. I also have sterile gloves that are unopened and not expired. And I also have a silicone Foley kit that is unopened and not expired. And now I'm going to go see my patient. Good afternoon, Mr. Potter. My name's Shannon. I'm going to be your student nurse this afternoon. Your physician has ordered a retention catheter to be placed now, so I'd like to go ahead and do that. First, let me verify your name, Perry Potter, and your date of birth, 5/5, and your MRN is 748 581258 748 581258. And can you tell me what day of the weekend is? Yes, it's Sunday. And what month is it? November? And who the president is? Yes, it's Biden. So have you ever had a catheter before? No? So what it is a rubber hose that goes into your bladder to get the urine to flow out for us. And we need to go ahead and do that now. And I do need to know if you are allergic to betadine or latex. No? All right, and I don't see any other allergies on here. Is that correct? Correct. No drug allergies. All right, so the first thing I'm going to do is examine your abdomen. We're going to put on gloves. Raise the bed. I'm going to inspect your abdomen, and it looks like that your abdomen is slightly distended. The mannequin is having some difficulty, so I'm just repositioning it. I would not have palpated my patient yet. I would inspect first. Now I'm going to palpate, or I'm going to touch your abdomen to see if you're having any pain. Can you tell me if you're having any pain here? No? All right. And here? A little pain? Okay. How about here? No? All right. And how about here? Okay. Now I'm going to tap on my finger on your belly. It's called percussion, to see if I hear any muffled sounds, which would indicate that there is urine in your bladder. And, okay. The sounds are muffled, so it sounds like your bladder needs to be emptied. We'll take care of that. I'm going to go ahead and get you ready for your catheter placement. I'll take off my gloves. And we'll clean the genital area. Putting on fresh. Oh, I need to wash my hands first. Put on fresh gloves. I have my basin with soapy water, washcloth and towel, and I would hold the penis. I would retract the foreskin if there is foreskin, and I would clean with 3 parts of the washcloth, 3 different parts. So 1, 2, 3. And then with another clean part of the washcloth, I will clean here. The foreskin will stay retracted during our procedure. Take my gloves off. Wash my hands. And prepare my sterile equipment. I have a stat lock, my gloves, and my kit. I'll be using this bag as the trash receptacle here on the side of the bed. I will position my patient's legs to make everything easy for us. Now open the kit. And I'm going to grab my drape and a 1-inch border. And the shiny side will go down to keep everything sterile while the patient is in the procedure. If anything had touched, I would get a totally new kit and start the procedure over to maintain sterility. Then next I would get rid of these gloves because I don't use them. And I would put on my sterile gloves. Alright, and I would drape the patient. Put the shiny side down. And prepare my supplies. My betadine. And my lubricant. Alright, and then I'm going to clean the penis. The foreskin is still retracted with 3 betadine wipes. 1, 2, 3. And I'm still holding the penis at a 90-degree angle. I would insert the catheter. Insert to the bifurcation. Then I would stabilize with this hand while not touching. Insert water into my balloon to stabilize. And I would remove all of this as one unit. Make sure that the catheter is stabilized by the balloon. Then I would get rid of these gloves, sanitize my hands. I have to get new gloves. I would clean my patient, get all the betadine off with 3 different parts of the washcloth. Alright, I will dry him. I would clean my area, and I would put on the securement device. This would be removed. The securement device I would use to make sure that the patient doesn't pull out the Foley, and I would make sure that there is plenty of slack so that the patient is not pulling. I would take the device and hang it in the lowest part of the unmovable part of the bed. I would rehydrate my patient, clean up my area, and throw everything away. Mr. Potter, are you okay? Does everything feel okay? Good. The urine is flowing unobstructed. I'm going to come back in 15 to 30 minutes to check and see how you are and make sure that everything is going like it's supposed to. Do you have any questions before I go? All right, so I would lower the bed into the lowest position. I would give my patient his call light, raise the bed rails at the top, clean my area, leave the room, sanitize my hands, and document the procedure.